Hello and welcome to the next episode of Dr. Welling Show. Today we are going to look at the most common causes of headaches and when you need to worry or take care and to visit your doctor. The head is one of the most common site of pain in the body. Headaches also are very difficult to explain to anyone, like it can be throbbing, it can be squeezing, it can be tightening, it can be all over the head, it can be at one location, it can just come for 5 minutes or it can last for 4 hours or it can last for 4 weeks. So it depends on the nature of how long the headache can be there. So let's start with the most common causes of headaches and then take it ahead. One of the most common causes of headaches are allergies. Now, whenever you have a headache preceded by a cold or a running nose or an allergy which has landed you into cough and then a headache, it is usually an allergic headache. You can know that very easily because you had running nose before that. It can be relieved by the medicines which you are taking for allergy, or when the allergy goes down, your headache also goes down. Next we come to cluster headaches. Now, cluster headaches can be headaches at one location, it can be close to your eyes or ear or at one location anywhere in your head. The next one is cluster headache. The cluster headache can usually be at one small location, it can be above your eyes or ear and then radiate all over the head. It can start at sleep and last for 3 to 4 hours. The pain can be really throbbing and disturbing your routine life. It can be due to alcohol one night prior, it can be excessive smoking, it can be also due to eye strains. Usually over-the-counter products for headache can help you with these headaches, but when it lasts for a longer time or it comes on continuously with common frequencies, then you need to visit your doctor. The next is a type of cluster headache which we heard earlier. It is an eye strain headache. As the word says, it is due to excessive eye strain, can be due to looking at the monitor or for a movie or by reading for a long time. Such headaches are usually at the front part and they are bilateral, equal on the both sides. The pain can be due to unchecked eye number, astigmatism, a type of eye problem, glaucoma, again a very common cause of blindness in India. So these are the ones which give you equal headaches on both the sides and above the eyes, the area which is called as frontal headache. Usually this type of headaches goes down after your vision is corrected or the root cause is removed, like astigmatism or the glaucoma is started. Usually such type of headaches have a treatment which is simple correction of vision. If there is astigmatism or glaucoma, they have to be treated. Eyes can be rested for some time. If you are watching TV for a long hours or you have monitor work going on, computer work going on for a long time, you need to go for regular eye exercises when you are doing long hours of work. The next one is a very common type of headaches which is called as exertion headache. Now this is after a lot of exertion. Whenever you get tired, you are completely exhausted, you get such type of headaches. It can be a long running, it can be exercise, it can be even a sexual intercourse. When you get tired, it can lead to exertion headaches. It can also be due to passive exercise or passive movements or simple movements like continuous sneezing, continuous coughing, repeatedly going to pass motion can lead to exertion headaches. Such type of headaches usually you need to find a cause, and for that you need to visit a doctor. Because it can be a complication which is arising, it can be a blood vessel which may rupture if not taken care of early. It can be without any complications, but that only your doctor can find out. It can be due to a tumor, it can be due to an aneurysm which I said earlier, a blood vessel may rupture. So these are the things which can lead to exertion headaches. The next one is fever headaches. As the word says, it should be preceded by very high fever or continuous low type of fever which leads to fever headaches. Such headaches go down as gradually as the fever goes down. The next are hangover headaches. Now hangover headaches are due to excess of alcohol consumption. These headaches usually come soon after drinking alcohol or the next morning. To take care, the only way is to let the alcohol level go down in your blood, to take liquids which have high in fructose like apple juice or banana. Obviously, it can be easily prevented by lowering your quantity of alcohol that you are consuming. The next we are going to discuss are hunger headaches. These usually come at meal times, and because the meal times have been delayed for a long time, you tend to get hunger headaches. The most common cause is very low sugar in your blood. Because of fasting for a long time, you tend to get hunger headaches. The common cause obviously are delaying the meal, missing a meal, and also oversleeping. When you tend to sleep for a long time, your energy levels are very low because energy is consumed during your sleep, and you tend to get headaches as soon as you get up. Hypertension headaches. Hypertension headaches are due to high blood pressure. A very easy way to recognize them are they are headaches which are around you feel like they are around a band or hair band like headache as it is called. The intensity of the headaches are very high in the morning and they reduce as the day passes. If you check your blood pressure, it will be close to around 200 and 110 or maybe crossing that. The treatment would be to not miss your high blood pressure medicines, and if you are not taking any medication, to visit your doctor to check for a blood pressure medication. Next also is a very common headache, which is migraine headache. Migraine headache are usually one-sided. They are followed by nausea or vomiting. You can be very sensitive to loud noise and sound, troubling and getting the headache intensity increased due to sound and any loud noise happening around. Due to excessive light, the headache increases. In migraine headaches, usually you will come to know beforehand that you are going to get headache. You might get slight dizziness. These headaches start after some stimulus, after eating something, after smelling something, or after experiencing some event. These migraine headaches start. So these are the most common types of headaches what we have seen till now. Remember, whenever you get a headache with very stiff neck, with high fever or dizziness, or you are not able to see very clearly with your eyes, or if you get seizures or epileptic fit, these are the signs that some complication is going to arise and you need to visit your doctor to get complete checkup done. So stay healthy till the next episode of Dr. Welling Show, and see you in the next episode. Till then, take care.